Can I have a gin martini while we're doing this?
Yeah, you're gonna get your drink coming up soon. That's the intermission part. Do you want me to tilt you back? Are you okay like this?
I'm okay.
Okay, so let me wipe down the toes. This is how we're gonna make it as easy as possible. When you feel the pinch, don't pull your foot away. Push your heel into the chair like this if it hurts.
Okay.
Okay?
Yeah.
We gotta do 2 pinches on each toe, and then the whole toe will be numb. So here we go. The most important thing is if you feel like moving, just push your heel down, okay?
Yep.
You're okay with this holding your toe?
Yep.
Okay, here we go. Nice job.
Got the anesthetic?
Yep, that's anesthetic. You doing okay?
Yeah.
Any pain right now?
A little bit, but not much. It was a while ago there was some more.
Very good.
I hold my foot stiff on you. That's probably not good.
No, no, you're doing well. Okay. So we got one more side, okay?
Yep.
Another pinch.
Oh,
I know, I'm sorry.
is that blood there?
Yep, that's where there's a needle hole. You okay right now?
Yep. That's strictly to get the anesthetic in, eh?
And a little toe that's super curled, yes. And we're doing the injection a little lower than we normally do because since we are going to cut the tendon, I just need to make sure that area that we're going to be in is completely numb. Pain right now?
No. Just a bit of pressure pain.
Pain here?
No, I can't feel a thing.
Okay. So I'm really making sure that lower section underneath the toe.
How long did it take us to wear off?
Around 6 to 10 hours.
Okay.
So at least it's going to be your friend for a little bit. So same little pinch, okay? So here we go. Sorry, just breathe. You okay? I know this toe's a lot more sensitive. You okay?
Yeah.
Going down a little bit?
Yeah.
Going down? Okay, we got one more side, okay? So another little pinch. Here we go. Nice job. This is the hard part. Pain now?
Yeah.
Still feeling it?
A little bit. No, it's gone now.
Okay. Yeah, I know your toe's not happy right now, so... Okay. So we'll let this sit. What's going to happen now is I'm going to bring in a tray, set up all the equipment, and then before we start, we'll test the toes to make sure they're completely numb.
Okay.
You check the toes are numb, you've wiped everything down. Off we go. So just remember that during the procedure, you shouldn't feel anything sharp, okay?
I'm sorry?
During the procedure, you shouldn't feel anything sharp. Pressure.
Anything sharp. Pressure's okay?
Pressure's okay. Nothing that makes you say, ooh, I felt like a little pinprick. But, you know, we've been seeing each other for a long time dealing with these corns on the top.
Right.
And I'm telling you, it's because of the Parkinson's, because of the way you're walking, the toes are continuing to curl. But now these wounds are becoming infected, they're not healing on their own. So that's why we've reached a point where we need to do something more aggressive. You have these claw toes, and there's 2 ways we can treat them. One is if they're flexible, meaning that I can put them straight, if we release the tendon, it can actually allow the toe to go a little bit straighter. The tendon will grow back, it will heal, but because we've cut it, it'll be in a more of a stretched position, and not have the same curl. You'll still be able to use the toes because there's other muscles that also help with pulling. But this is temporary relief. If this toe was rigid and we weren't able to bend it without us moving it right now, then it's a bony problem, and then we have to do bone surgery where they break the joint and set the toe and create a new straighter position. Actually,
Oh, we won't have to go there.
no, your toe's flexible, so what we're gonna be doing is just this way, okay?
Yep.
What we're gonna do is finding that spot where the tendon reaches the bone. You okay here?
Yep.
Any pain? Any pain?
Time.
There we go. So I felt the release. Now we have way more flex.
I didn't feel a thing.
No, so now we can actually get the toe to go much straighter. You see this now? And you could hear it. Did you hear the pop?
No.
Did you hear it?
I can't hear things.
That's okay. So I'm just gonna make another check.
You're cutting more off now?
No, I'm just making sure that everything is cut.
Okay.
That's it. So this is by a stab incision. So we don't need to do any stitches. It's going to be very easy to just close up on your own. And usually within 1 week, the whole thing's already sealed.
Okay.
So I'm going to put a little bit of cream in here. Put some gauze. And we're going to be doing what we call the buddy system, where we put these two toes together.
Can I see what you cut out?
You don't see. So there's nothing we pull out.
Oh, I see.
So think of a rubber band, and we just snipped the rubber band.
Okay.
That's what we did.
Oh, you put those two together, right?
They're going to be buddies.
So I leave this on until I see you next, right? I don't touch it.
No, you're going to be changing this every day.
Is that right?
Yep.
I'm gonna get in here for that. She'll do it.
I'll go through all the instructions with Miss Model.
Okay.
And that was it. So again, this is not an invasive procedure. We don't have to cut any bone. We're literally just releasing the tendon. One down. Okay, that was one done. So one more, okay?
Yeah.
So again, what we're doing is finding the space where those tendons run underneath the bone. Any pain?
You've done this before, I can tell.
Yeah, I just did it. Sorry, felt the one little click.
Oh my God.
So toe much more flexible, so I'm just making sure everything is.
Finished cutting?
Yep.
Oh God, I'll be so glad to walk again. It's only been a few weeks now, but incapacitates me.
That's it. So you can see the toe is so much more flexible,
My God.
and that's what's going to give you relief and stop these wounds that are forming on the top of your toe.
I'll just go out.
Yep, they'll go back to normal skin. So, we'll do one last check, but that's pretty much it. You see this now?
Yeah.
It's loose. Uh-oh, you're gonna say you're loose like a goose now. And no stitches. Okay. So we'll dress her up. He just wants to see this, so
You have to do this, so I want you to see it.
Oh,
so you can see what it is. This is
well, sure, now I'm gonna be sick.
this is the hole.
Watch how flexible it is.
That's all it is.
Wait a minute, where's the hole?
Right there.
Oh, the blood's coming out, okay.
So it's just
yeah.
that little hole. So what
Okay.
happens is you're going to be putting some antibiotic cream.
This has to be done
And a
every day,
Band-Aid.
Colin, so that's
And a
what I wanted
Band-Aid.
you to see it.
I'm giving you gauze just in the first day or two if it's bleeding a little bit, but really it's just going to be antibiotic cream and a Band-Aid. And then I'll show you how I'm going to put the little bit of the wrap on. So I'm basically just going to put the cream in that area. I'm going to put a little bit of gauze. You really, if you need to put gauze, just put 1 or 2 little pieces. You don't have to put as much as this. I'm just putting it on today for the blood. And then what you would do is we can wrap these 2 toes together. And you can just wrap it once or twice around. You don't have to wrap it as much as I am. This is just because of,
The first day.
yeah. You just wrap it
What
once or
about
twice.
him having a shower and stuff?
He can shower as long as this is covered up. Then after the shower, take everything off, dry the toe, and put a new dressing on.
Well,
So
when you said covered up, you mean covered up like this?
covered up like this.
Okay.
So we can leave this on.
See, honey, this is why you won't be wearing a shoehorn. A shoehorn. That's why I got this. So you can wear a sock on.
Oh, I can put my sock on and
The toe is super flexible now.
Is it?
It's able to go really flat. It's going to feel different. It's going to almost look like it's lifted, but that's normal. As time goes on and the toe tendon reconnects, it'll start to have more of its normal curl, but a little bit. It will never have the same amount of pull. And this is what we want. So there's less pressure at the tip. Okay?
Oh, we did both of them.
We already did
Okay.
both. So we're just going to clean them up a little bit. We'll get the spray, the saline spray.
Are you
That's
going
it.
to give us the antibiotic and the,
Yep.
so for 1
Wrap at the
week,
end.
for 1 week we do this, and we can.
Yes, you dress it in the morning.